The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name is Mark Ryan. It's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today, we're going to be talking about the recent Commonwealth Fund Mirror 2024 study. And it's very interesting because every 3 years, the Commonwealth Fund does a great public service by publishing its Mirror 2024, in this case, a portrait of the failing U.S. health system. And basically, it compares and contrasts different measures and metrics across a number of different developed world healthcare systems. This is actually the 8th report that the Commonwealth Fund has done, which relies on surveys as well as national and international healthcare data that's performed in these countries. The 2024 analysis accounts for the COVID pandemic, which is good. They've made some allowances in there, and results are consistent with previous years. So we're not seeing any major bombshells here. In effect, what the Commonwealth Fund is doing here is it's ranking healthcare systems' performance based on leading access, efficiency, quality, and value metrics. These are pretty much metrics and ratings that are pretty much quantified throughout the developed world. It looks at 70 health system performance measures in 5 areas: access to care, care process, administrative efficiency, equity, and health outcomes. And I think we can all agree that those 5 foundational domains are pretty important in assessing how we're doing in our healthcare system. This year, 2024, the last one was in 2021, the Commonwealth Fund compared statistics in 10 countries instead of 11. The 10 countries are Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, the United Kingdom, and the United States. Norway was in the 21 study, and it actually was ranked number 1 in that 21 analysis. But it dropped off the analysis list this year because it exited the International Health Policy Survey, so they couldn't really gather enough information to include Norway for 2024. What the study notes is that 9 countries, not the USA, have their strengths and weaknesses, but all have found a way to meet their residents' most basic healthcare needs, including universal coverage. The 9 rank high on some dimensions and lower on others. But another thing is really clear here. The only outlier on performance of the study group, these 10 nations, is again the United States. Commonwealth finds that the other 9 developed countries have overall performance differences that are relatively small. The U.S. is last and performs demonstrably worse than even the other lowest performing countries. Commonwealth calls the U.S. performance, quote, dramatically lower. As before, the U.S. does rank 2nd in the care process domain, giving us insight into, in my view, have versus have not dilemma here in America. If you have wealth or have great insurance, you get great care, or at least you can try to get great care if you put effort into it. And you have a great chance of being healthy if you want to be. But if you're a have-not, if you aren't wealthy or have no or poor healthcare coverage, you are very much out of luck in the United States. Commonwealth again substantiates that the U.S. spends the most on healthcare from a percentage of gross domestic product standpoint, yet performs the worst. So not only do we have poor quality and efficiency based on all the metrics that they analyzed, but we have the lowest value of the developed countries studied. So that's just a quick overview of what was found. What's really important here, as I always do, and you hear me in some other podcasts too, before we go deeper into the study and before we take our first break, I want to tell you once again about healthcare system types. Again, we talk about it all the time, but we need to sort of talk about it here, just given significance of the outcome study here. There are at least 3 types of healthcare systems in the developed world. It is important to note that the 3 types and their characteristics are not really absolute. Nations may use combinations of characteristics of each, or even have exceptions in terms of how care is furnished. But in general, we have these 3 types. So let's go through them quickly. There is the socialized or state-run healthcare system. A good example of this type is the United Kingdom's healthcare system. In this type, for the most part, the government runs, finances, and delivers services. Again, those roles are not absolute in socialized medicine, and especially in the United Kingdom. Britain has begun contracting with private providers for some delivery of care, especially in the primary care world. So you can see how some private markets also get into the socialized system as well. A second type is the single-payer system. The government runs and finances the system, while private entities largely deliver the care. France, Australia, and Canada, the provinces, the individual provinces, are good examples of this single-payer system. And last, the third type is what's known as affordable universal access using a private system. In this type, the government regulates and finances some coverage, but private entities run the system and deliver care. They run the health insurance system and the delivery of those services. Examples of nations with this system type are Germany, Switzerland, and the Netherlands. Now, we've talked about Germany, Switzerland, and the Netherlands in the private type, France, Australia, and Canada for the single-payer type, and the United Kingdom for the socialized medicine type. What's interesting is almost all of these nations are in the Commonwealth study. And again, what's interesting about it is that all 3 types perform well on the Commonwealth study. What the Commonwealth Fund study is also concluding is that you can have highly functioning private delivery, affordable universal access systems, single-payer systems, and socialized medicine systems, and they can all perform well if they're run properly. What type of system is the United States closest to? Well, it would appear like we are the closest to the private affordable universal access system, because we do have private insurance and we have private delivery of care. One of the differences between the U.S. system is that the U.S. system is primarily employer-based, whereas in other nations, private systems are centralized and, again, not primarily employer-based. But more importantly, it's important to remember that while the U.S. may look like a private affordable universal access system, we do not have affordable universal access as those other private systems in developed countries have. What's important to note about all 3 system types, but not the U.S., is that all of them emphasize enough government funding to ensure affordable universal access for all citizens. Government financing comes from various sources, including value-added taxes, business taxes, income taxes, and employer and individual contributions. But again, the U.S. does not have that affordable universal access commitment. We've made some strides toward that with the Affordable Care Act and expanding Medicaid and things like that, but we just haven't reached that point yet because, as I always say, we have tens of millions that are still uninsured. And in toto, if you look at both the uninsured populations and what I call the underinsured populations, people may have coverage, but they really can't afford to use their care consistently. We have about 85 million people in those 2 categories, uninsured and underinsured. So with that brief intro to what the study found, as well as the description of healthcare systems, we'll take our first break and be back shortly.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the Commonwealth Fund's Mirror 24 study, a portrait of the failing U.S. health system. And so now we're at a point where we're going to give you a little more details about what the study found. First, let's start with the top three countries here. The top three countries in terms of achievement on those various dozens of metrics that we talked about earlier were Australia, the Netherlands, and the United Kingdom. What is interesting again about the results is that the top three represent each of the three types of healthcare systems: socialized medicine, single payer, and private affordable universal access. Again, as I said right before the break, it proves that each type can be well run, quality producing, and deliver for their citizens. The thing they have in common, again, is affordable universal access to healthcare commitments. So let's just run down the 10 countries again: Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, the UK, and the US. And in rough measure, the rankings are Australia, number 1, the Netherlands, number 2, the United Kingdom, number 3, New Zealand, number 4, France, number 5, Sweden, number 6, Canada, number 7, Switzerland, number 8, Germany, number 9, and the US, number 10. And as I emphasized earlier, what's interesting, at least about 9 out of the 10 countries, setting aside the US, they can rank dramatically different in the 5 domains: access to care, care process, administrative efficiency, equity, and health outcomes. So as a good indication, just to give you a couple points here, we told you that Australia, with their single payer system, ranks number 1. Well, they did rank number 1 in health equity and health outcomes, and they ranked number 2 in administrative efficiency. But they actually ranked number 9 in terms of access to care, in Midland at number 5 with care process. If we go over to the Netherlands, which is a private affordable universal access system that ranked number 2, again, we see a similar pattern. In this case, while Australia was number 9 in access to care, the Netherlands ranked number 1. But they also ranked lower on a few scales. While Australia was number 2 in administrative efficiency, the Netherlands was Midland at number 6. And in health outcomes, the Netherlands was number 7. Same thing with the United Kingdom, a socialized medicine country that ranked number 3 overall. They ranked number 1 on administrative efficiency as well as number 2 on access to care, but they ranked at the bottom 8 in terms of care process and health outcomes. Again, I want to emphasize the fact that the differences in these top 9 countries are not great, but it does show you in terms of the rankings on the domains that there are disparities in these systems, and in many ways, they could learn from each other, as I'll point out again as we move on as well. Let's get a little more into where the United States ranked in these domains. As I told you already, the United States ranked dead last, number 10 of all the nations studied for the overall ranking. But we also received a 9 or 10 on 4 of the 5 domains. On access to care, we ranked number 10. On administrative efficiency, we rank number 9. On health equity, we rank number 9. And on health outcomes, we ranked number 10. Let's talk a little bit more about why that was the case. Well, in access to care, as I've already made the case, we do not guarantee affordable universal access. As I said, we have tens of millions uninsured and many more that are underinsured, and that largely is driving our dead last number 10 rating for access to care. When it comes to health outcomes, where we got a 10 last as well, again, we know that our health outcome statistics in all areas, or at least the vast majority of areas, we do very poorly compared to other developed nations. We have chronic conditions that are not well maintained, as opposed to what occurs in other developed nations. The number of admissions, for example, for exacerbation of chronic conditions is very high in the United States. So our health outcomes, including life expectancy, for example, and things like that, is very, very poor, giving us, again, that 10 rating. On administrative efficiency, we ranked 9, second to last. And in this case, this makes sense as well. We have tremendous overlap. We have tremendous waste, fraud, and abuse. All of this adding to our overall cost to show that we're not particularly efficient. And then in the last area, health equity, we know there are statistics that really show that people of color and people of certain ethnicities simply do not have the same chance of success for health and the same access to care and things like that as other populations do. So again, second to last in the health equity area. Let's go to the issue of care process, though. As we did before, in the area of care process, we ranked number 2. And why would that be the case? Well, it tells us again that if you have strong insurance in America or are wealthy and can afford to pay out of pocket, the U.S. system can excel in some things such as preventive care, safe care, coordinated care, as well as engagement in meeting patient preferences. These are sort of the subdomains of that care process area. So again, if you have great insurance or can afford to access the system and money is not an issue, you're probably going to go and get all your preventative care services. You're probably going to pick providers that are very safe. You're going to probably get coordinated care, as I noted. And again, you will probably have providers that emphasize engagement and meeting your personalized preferences. So that makes a great deal of sense. But again, if you're not one of those individuals that are accessing the system with great coverage or can afford to pay out of pocket, you're not going to get access to that great care process at the same time. I would also note that the study says that America succeeds in this care process domain in part due to the successful provision of preventative services generally. So there's some more global application to our rating there, such as mammograms and flu vaccines as a good example, as well as our emphasis on patient safety. We have gone a long way to emphasizing that in our system. So we should give ourselves some global credit there too. Commonwealth says our high ranking here might reflect the vigorous STAR pay-for-performance policies in Medicare Advantage and some fee-for-service pilots as well. So that's interesting that perhaps some of these STAR programs in MA and for accountable care organizations are having a halo effect in terms of some pay-per-performance aspects in our system. On patient safety, the study also points to our significant reductions in adverse events during hospital stays for heart attack, heart failure, pneumonia, and major surgeries. So again, we can applaud this in the U.S. system despite sort of our low rankings in other areas. But as I emphasize, if you are one of those tens of millions who are uninsured or underinsured, you very much fall through the cracks in America. And again, you don't get the benefit of the outstanding care process. you are very much getting America's 9th and 10th place finishes in those other areas. Let's talk again a little more about spending. I told you that in the introduction that the Commonwealth study again found that we spent the most and had the worst outcomes. And the Commonwealth study looked at the rise of U.S. healthcare spending over time. It found that in 1980, U.S. healthcare expenditures were at the high end of the distribution of the nation's studies, but were still comparable in 1980 to Sweden and Germany. So we weren't really an outlier on spending. We were within what developed worlds were spending at the high end. But over the last 40 years since 1980, U.S. spending has far outpaced that of other nations. Commonwealth looked at 2022 spending and determined the U.S. spent more than 16% of its GDP on healthcare. I used the CMS actuary number, and I actually think in 22 it was closer to 17.3%. But nonetheless, that's the number that Commonwealth gave. That figure is predicted to rise over time and hit 1/5 of the economy quite soon, actually. What happened in other countries on spending since 1980? Well, the other countries in the survey spent between 4% and 8% of GDP in 1980, and in 2023 spent between 8% and 12%. And confirming the old adage that more isn't always better, the two countries with the highest overall rankings, Australia and the Netherlands, one a single-payer system and one a private affordable universal access system, they have the lowest healthcare spending as a percentage of GDP. Thus, America's value performance compared with spending is the lowest and also a huge outlier, and that has grown since the 1980s. And so with that, we're going to take our next break before we get into some of Commonwealth recommendations on where the U.S. could become better and some of my recommendations from my book, The Healthcare Labyrinth. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about the Mirror study, which looks at outcomes in various areas for healthcare systems in 10 developed world countries, including the United States. So we promised to talk a little bit about recommendations from Commonwealth and then some recommendations I have in my book, The Healthcare Labyrinth. So first, let's get to the Commonwealth recommendations. The Commonwealth Fund suggests a number of things to help us improve. First, it suggests we look at the high performers in each category. It again notes that performance in domains can be very different, and therefore every country can pick up some improvements or best practices from another. So that would be very important to do. Number two, it says we must address financial barriers to care, which are very significant in the U.S. This involves both the uninsured and the underinsured I've been talking about. It notes that 1/4 of the insured are underinsured, exactly as I've been saying. And again, I peg the uninsured and underinsured count at between 80 million and 85 million Americans. Third, Commonwealth suggests America must invest in primary care. Another big recommendation I always have as well. We have a fundamental lack of investment here and instead have an excess reliance on high-cost places of services, such as hospitals and emergency rooms. We also tend to have more specialists than primary care physicians compared to the developed world. Finally, Commonwealth, a fourth recommendation, actually not finally, there's another. It says more regulation may be necessary, including simplification of products, processes, and more. Consolidation has raised prices and not saved. That's something I always talk about, hospitals consolidating and taking over physician practices. And Commonwealth says these need to be addressed. And I would note that the Biden administration has begun a focus on antitrust in healthcare. So that is an important element as well. And lastly here, number 5, Commonwealth calls for much needed public health investments. As I've always argued, our public health infrastructure is incredibly fragile. We do not make enough investment in education on diseases. We do not make enough preparations for pandemics and other kind of public health emergencies. Because we're a federal system, investments in public health can be extremely low in certain states, higher in others. We need a national program to help drive public health investments, because ultimately that's what will also make the population healthier and goes hand in hand with affordable universal access and healthcare system reform. Let's get to some of my recommendations here. The Commonwealth Fund recommendations dovetail with many of my findings and recommendations in my book, The Healthcare Labyrinth. I have written a series of blogs and done some podcasts. So you can see those at the blog tab and the podcast tab of my website. These summarize the healthcare reform proposals in my book. Simply put, I have 3 overarching reform areas to bend the cost curve and improve quality and outcomes. First, as you can suspect, affordable universal access. Again, we have 80 to 85 million uninsured or underinsured. While the Affordable Care Act expanded Medicaid and created exchange coverage, it has not closed the uninsured gap completely and still leaves many people underinsured as well. We have between 8 and 10% uninsured, while most developed countries sit at 1% on average. And given the huge costs of our system, the premiums and cost sharing Americans pay are well above other developed countries. That's part of our uninsured problem. There is a real issue of affordability of healthcare represented by the underinsured. We need to adopt the true principles of a private universal access system where we are giving everybody the chance to be covered, and we are giving everyone the chance at subsidies that give them true affordability so they can access the system on an ongoing basis. If we don't have that, we just simply will always have poor outcomes. The next area I cover in my book is price. America has a huge price problem across the board, and this leads to unaffordability for many Americans. While all other system types set prices globally for their systems, America does not, save for maybe the Medicare and Medicaid fee-for-service programs. Price in U.S. healthcare is many folds above other developed nations. This is acutely so for hospitals and drugs. The exorbitant prices for drugs and services drive our healthcare spending and, again, make things unaffordable, which, again, impacts access to care. And my third primary area for reform in my book is health, wellness, primary care, and care management. The U.S. system does not prioritize wellness, prevention, and management of disease states. It is obsessed with utilization management as opposed to care management. We need to pivot to care management from utilization management. So with those recommendations in place for both the Commonwealth Fund and my recommendations from my book, we'll take our last break before we get back for some conclusions and just asking the question, is everything perfect in the rest of the world? Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We are featuring Mirror, Mirror 24, the Commonwealth Fund's periodic study of how the United States ranks against other U.S. developed systems. We've talked about the fact that it's at the bottom of the barrel, and it's actually an outlier in terms of healthcare outcomes and efficiency against 9 other developed world countries. So I told you we were going to ask the question, is everything perfect in the rest of the world? If all those other countries are nestled together well above the United States outcomes, it must be a perfect world out there in the rest of the world. Well, the truth is, no, that's not the case. Even as the United Kingdom was rated among the top 3 countries for healthcare in this Mirror, Mirror study by Commonwealth, the UK is actually reeling from a just issued report that looks at all the problems in the UK system and makes significant recommendations for reform. That study link is in my blog post on this, and I think it's really interesting to read. Let's get into a few findings and recommendations that this UK report makes. So it concludes the National Health Service is in serious trouble. It says the health of the nation, the UK, has declined and social determinant impacts have worsened, which contributed to the problems at the NHS. The report said wait times for services are up across the board, including primary care. Emergency and hospital care wait times have ballooned. Cancer care is lagging other countries. Care for chronic disease is deteriorating. While quality of care is good, the record is mixed. The report also says too many dollars in the United Kingdom are spent in hospitals when it should be in the community. This is leading to more being done at higher cost places of service. Operating and capital spending was too austere in the past, including in new technology. It says there is a lack of staff and patient engagement and a lack of management structure and oversight, and therefore reform is needed. So some of what this report is saying is happening in the UK are clearly large problems here. A lack of focus on primary care, overutilization of hospital care, lagging cancer care is a problem there. Care for chronic disease is starting to deteriorate. You can see some of the trends in the UK. What I think it shows is that the UK is worried about taking a step backward. It's nowhere near what's happening in the United States, but it's starting to see deterioration. And at least some of this was really related to a lack of investment at points, as the report notes in the past. And so they're looking to right that ship. But I just thought it was interesting to bring this report into this podcast because not all is completely well in other developed countries, despite the fact that their outcomes are much better and the overall status of their healthcare system. And it's certainly not confined to the United Kingdom either. You can read press reports from other high-rated developed world countries where some of the same things are being said. In the end, despite some problems, these other nations' systems function much better than America does from an efficiency and quality standpoint. Some might ask, for us to reform healthcare, does this mean we give up our current employer-based system and migrate to one of the 3 types that other developed nations have? Not necessarily. America could keep its employer-based system, which a majority of Americans seem happy with, but drive toward efficiency and lower price and costs emphasize care management, and close the care gaps. It would take lawmakers on Capitol Hill to get serious about affordable access, tackling price, and pivoting from utilization management to care management. But the recipe is out there. Commonwealth has said it. I've said it in my book, The Healthcare Labyrinth. Think tanks and policy experts have laid it all out as well. But courage in Washington, D.C. is often fleeting. And unfortunately, it does not appear that healthcare reform is on the horizon in America anytime soon, despite the constant reports from Mirror Mirror that the U.S. healthcare system is in dire need of change. With that, we'll conclude this episode of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.